people either refuse to look or they refuse to accept. But either way, we're just going to keep pushing.
I have a lot of low T symptoms with mid-range total T levels, 400 to 600. My doctor prescribed me Enclomiphene 25 milligrams every 3 days. What's your opinion on this protocol?
Absolute garbage. Enclomiphene is a selective estrogen receptor modulator. It's going to block the estrogen receptors primarily in the brain. It can also block the receptors in the optic nerve. It can lead to floaters and vision loss over time. It can lead certainly to depression and mood swings. So all clomiphene versions, and the only difference between clomiphene citrate and enclomiphene is 2 isomers instead of 3. So it doesn't have the estrogenic impact of raising serum estrogen, which is kind of moot anyway. They all serums raise SHBG. It will systemically lower free testosterone over time, secondary to SHBG elevation. It's going to paint a pretty picture on labs. So you have this nice piece of paper, to say, hey, look, all my labs look great. But in the real world, it's going to translate into all of these negative symptoms within 6 to 12 months. It is not a lifelong treatment, and I don't suggest it for anyone.
Yeah, I'm not going to ask you why some doctors always start with that. I've heard it here as well.
Ignorant and uneducated about hormones. That's why we do these. We do these because we're trying to put the information out there, the correct information, evidence-based information, anecdotal information, peer-reviewed information. I mean, this is all stuff that is out there. People either refuse to look or they refuse to accept. But either way, we're just going to keep pushing.